your chest. So the reason why it's smaller is to create room for the heart to fit. Another thing is the lungs do not expand by themselves. This is carried out by the contraction and the relaxation of the muscles in your chest wall. On average, you take about 8.4 million breaths per year, and it's the only organ that floats on water. And if you're learning how to swim, how to float, you'll be told try to fill your lungs with air. Make them buoyant as possible. Because you can see this gentleman here is floating, and his chest is outside, is protruding, as you can see, and they're definitely filled with air. Also, its mass is composed of 85% water. Now, this is about 10% more than the average water composition of general body. So the water is essential in gaseous exchange, as gases can only diffuse into and out of the blood only after they've dissolved in a solvent. So the reason why the greater component of your lungs is water is so that these gases can dissolve in the water and diffuse into your blood system, and also so that the gases that are supposed to leave, the carbon dioxide, can diffuse out. And if you can try an experiment next time, just take a mirror and breathe as close as possible into the mirror, and you'll notice that the mirror will fog up. If you're continuously doing that, you might notice some small water droplets. These are actually from your lungs. Other functions of the lungs include sound production, singing. It assists in smell, swimming, the floating, and also holding your breath, and also simple things like blowing the candles. So having put into perspective some of the most important things that the lungs do that we take for granted, like, for example, you're hearing my voice right now because my lungs are pushing air out of my chest and then through my vocal cords in my throat. If you enjoy singing like I do, you do understand that part of singing is using the lungs. For you to smell, you need to pull in the fumes or whatever scent it is that you want to smell through your nose. So today, as you go for lunch, and a nice plate of beef stew is in front of you, and you smell it, understand this is your lungs helping you out. This is you should appreciate your lungs better. Now, I'm going to take you through some of the common illnesses that may affect your lungs, and also we're going to go through how you can try to protect yourself, or at least minimize the risk of you contracting such ailments, or even if you have them, how you can reduce the diseases from progressing. And the first one is asthma. So with asthma is a chronic disease of the airways that makes breathing difficult. Asthma causes inflammation or swelling and a narrowing of the airways, making it more difficult to breathe. The irritated cells in the airways make more mucus than usual, causing narrowing of the tiny airways. So you can see these are the airways inside your lungs. This is a normal one. You can see it's wide, and if you have an asthmatic airway, you can see it's much narrower. You can see there's a lot of secretion, a lot of mucus, and basically we treat asthma using medications that will cause this airways to become bigger. One of them is this inhaler. As you can see, that lady over there is about to take a whiff of the inhaler. So this narrowing can be triggered by irritants in some form of asthma, maybe cold weather, dust, or smoke, or whatever case it may be. The second kind of ailment that will affect your lungs is known as pneumothorax. So pneumo stands for air, thorax stands for chest, so basically air in your chest. So what happens in pneumothorax, it occurs when air leaks into the space between your lungs and your chest wall. The air pushes on the outside of the lungs and makes it collapse. Now look at this left lung, you can notice it's smaller than the right one. So what happened in this case is that there could have been a perforation on the lung itself, and then the air came in down and started filling this region over here. It's called the pleural cavity. And as the air fills this cavity over here, the lung will collapse. And it can be very dangerous, especially if it happens on the left lung, because what happens is that when this lung collapses, it will engulf your heart. And your heart needs to relax and contract. So the relaxation of the heart will be impaired. Your cardiac output will be decreased, causing a condition known as cardiac tamponade. So how do you treat this kind of condition? You do what is known as a thoracostomy, where you insert a needle on the chest wall, between the second and third intercostal space, so that this air can can come out. What can cause a pneumothorax? Let's say a lung infection, if it's severe. Let's say trauma. The most common cause is trauma. When something perforates a lung, be it a bullet or a stab. Someone got stabbed in the chest or whatever case it may be. The next condition is known as bronchitis. So bronchitis is an inflammation of the lining of your bronchial tubes. So allow me to go back here and show you something so that we can. So if you notice that, if you look at the anatomy of the lung, you'll notice that there is this throat, your throat, which is known as a trachea over here, going down, and then it branches off into this branches known as the bronchus. Then the bronchus, one is the bronchus, there are many, it's bronchi, further divides into smaller tubes known as bronchioles. So as I was talking about asthma, I was referring to these small tubes here called the bronchioles. So when you have an inflammation of the bronchi, or you have what is known as bronchitis, an inflammation of the lining, of your bronchial tubes, which carry air to and from your lungs. People who have bronchitis often cough up thickened mucus, which can be discolored. And one of the most common cause of bronchitis is smoking or inhalation of air pollutants. So with such a patient, you'll see a lot of secretions in the bronchioles, which will obstruct air from reaching the alveoli, the small ball sacs the small sacs, the small air sacs rather, at the end, at the terminal of your lungs. Then you have what is known as chronic obstructive pulmonary disease. COPD refers to a group of diseases that causes airflow blockage and breathing related problems. And you can see, just like in bronchitis, you have narrowing and you have a lot of mucus in the bronchiole, which will hinder the. Oh, sorry about that. Let me just. Sorry, can you see that? All right. So you can see the same. You can, as you can see in the picture here, there is blockage of the bronchioles, which obstructs air from reaching. It obstructs air from reaching the alveoli, where the gases are actually exchanged. And then you have what is known as pneumonia. So pneumonia is just a broad term for infections of the lungs. It could be bacterial, it could be fungal, it could be parasitic, or it could be viral, like COVID pneumonia. So basically, you have inflammation of the lungs, which is as a result of an infection. And as your body is trying to fight off the infection, you have what is known as an inflammatory response, which leads to the production of a lot of fluids that can clog up your alveoli and impeding proper gaseous exchange. Then you have what is known as pulmonary edema. So pulmonary edema is a condition caused by excessive fluid in the lungs. This fluid collects in the numerous air sacs in the lungs, making it difficult to breathe. So as you can see, when we zoom in to the lung, into a group of alveoli over here, this is a place where gaseous exchange actually takes place. This is where the gas oxygen will diffuse into your blood vessels, and carbon dioxide from your blood vessels will diffuse into the alveoli, where it's going to be expelled when you breathe out. So I've covered a couple of conditions that will make your lungs get filled with fluid. But what is specific about pulmonary edema is that this fluid that fills your lungs is actually from your blood vessels. It's usually the fluid, the leakage is from the blood vessels. So conditions that can cause you to have pulmonary edema are like kidney conditions, kidney disease. You can have heart problems, can also cause you to have pulmonary edema. And then you have pulmonary embolus. So you have pulmonary edema, and then you have pulmonary embolus. Pulmonary embolus, or otherwise known as PE, pulmonary embolism rather, PE, occurs when blood clot gets clogged in an artery in the lung, blocking blood flow to a part of the lung. Blood clots most often start in the legs and travel up through the right side of the heart and into the lungs. This is a condition that is known as deep vein thrombosis, and I believe we should there is lack of awareness of this condition, deep vein thrombosis. So you will have a clot forming. Usually it will form in the veins, the larger veins in your legs. You can experience lower limb swelling, redness or painfulness. And then this clot may break off and travel all the way into your lungs, and that's where it can get trapped, and then you have lung damage because certain parts of your lungs are not receiving proper circulation. Some of the conditions I believe I should mention that can increase the risk of you developing a clot in your leg, which can travel into your cause a pulmonary embolism, or being seated for a long periods of time. You can have things like anything that can damage your blood vessels in the leg. Let's say, for example, you injured your foot, you broke your one of the bones in your leg. Also, abdominal surgery or a pelvic fracture. Yeah. For example, a cesarean section, can also predispose you to getting an embolus, which can later on travel to your chest and cause a pulmonary embolus, which is a life-threatening condition. Then the other condition you see another ailment you'll see affecting the lungs is lung cancer. Now, first of all, I'll quickly define what cancer is. Basically, cancer is a group of cells that are dividing uncontrollably. And what happens is that, okay, cell division is an important part of your body growing, of repair. But in the case of cancer, you have a group of cells that are dividing uncontrollably, one, and also the cells that are being formed are different from the cells that were initially there. In other words, they're dysfunctional. They don't do work the same way they're supposed to do. So you have a group of useless cells replacing healthy cells. And then this group of cancerous cells are what are known as a tumor. You can see there's a tumor there in the lung. The leading cause of lung cancer, of course, as we all know, is smoking. So now that you know the bad things that can happen, that may happen to your lungs. So we get to the meat to the meat of the matter, which is how to show love to your lungs. How do I improve my lungs? How do I show my lungs that I actually appreciate them for the work that they've been doing? So number one, don't smoke. Smoking is the leading cause of lung cancer and COPD and also bronchitis. And just apart from lung cancer, many other cancers have been associated with smoking. Number two, avoid exposure to irritants if possible. So we're talking about air pollution, we're talking about smoke, we're talking about dust, Remember, if you live in Nairobi, this is a place that, there's a lot of pollution, right? So we need to be extra careful. You can try to wear a mask if possible. And then we also want to prevent infections that can affect the lungs, just infections in general. This can be done by hand washing with soap or alcohol-based sanitizers. Try to avoid crowds during flu or cold seasons or any other future pandemics. Get vaccinations. Get vaccinated against COVID because it can cause pneumonia. Influenza as well, it can also cause pneumonia. Then good oral hygiene, because poor oral hygiene can lead to an upper respiratory tract infection, which can complicate into a lower respiratory tract infection affecting your lungs. Also protect other people, not just yourself, by isolating in case you contract a transmissible lung infection, like you are diagnosed with TB or pneumonia or COVID pneumonia. It's important not just to care about your lungs, but also the lungs of the people around you. Also, it's important to get regular checkups. This can help to diagnose early chronic illnesses that may affect the lungs, like lung cancer. Exercise is an amazing way to keep your lungs healthy. Jogging, try to do cardio jogging, swimming. All these are very good. all these are very good ways to these are very healthy lungs.
Maji ilikuwa ni hata Nairobi amko mnakuja jini mbali.
So that leads me to the end of my presentation. I now leave this room for I will leave this room for anyone who has questions to ask. Do you have any questions? I'm open to any questions.
Hello, thank you, Dr. Hilary. Thank you for the presentation. It's an informative one. So I think we can take questions. You can raise your hand. Then from my side, I'll be able to pick you. Alternatively, you can write from the chat to be able to read. Yes, Christian, you can go ahead with your question.
Thank you very much for this wonderful session, Dr. Tarus. My question is, what are the symptoms that one can start experiencing when they're having what you call pulmonary embolism?
Yes, Dr.
Yes. Okay. So in the case of pulmonary embolism, that's a very good question. A patient can experience an onset of shortness of breath. The symptoms will typically appear suddenly and then they'll begin to get worse. The patient will have chest pains. The patient might have a cough, which will produce some sputum with some blood in it, and then patient might experience maybe some sweating, some rapid or irregular heartbeat. And now usually with such patients, they usually present with a history. Not all, but most of them will present a history of deep vein thrombosis, a clot in the leg. They'll tell you, my leg is swollen, has been swollen for 2 days. That lets you know that, okay, this is probably where the embolus, the clot, originated from. So most people who are at risk are usually the elderly people or people who sit for long periods of time. You have that history. People who've been taking oral birth control pills can also make it easy for you to get a deep vein thrombosis. So just to answer your question again, you're looking for chest pain, a shortness of breath, and then a cough that produces sputum with some blood. I hope I've answered your question. Yeah.
Yes, thank you very much, Dr.
Okay. Thank you, Christian, for your question. So let's have questions. You can even type from the chat. Okay, Dr. Tarus, there's one here. What is the relationship between pneumonia and COVID?
I will say, all right, fantastic. So pneumonia is a broad and general term for any infection of the lungs. All right. COVID, on the other hand, is one of the viruses that can not only infect your upper respiratory system, but also your lungs, causing COVID pneumonia. So COVID can cause pneumonia, but not all forms of pneumonia are COVID. In fact, majority of the pneumonias that you see in a clinical setting will be as a result of bacterial infection by a bacteria known as Streptococcus pneumonia. So COVID itself is a viral type of pneumonia. Have I answered your question? It's the same as I would say, if I can, like I said, I like to use metaphor. It's like saying what's the relationship between birds and chickens. Chickens are bird, but not all birds are chickens. If you understand what I'm saying.
Okay, thank you, Dr. Tarus. Okay, there's another one here asking, is it possible for the scars from TB to completely heal?
Pardon?
Yes, is it possible for the scars from TB, maybe previous TB infection, that they can completely heal?
And unfortunately, it's not possible if you have what is known as fibrotic changes. In other words, there is the TB will destroy the cells in your lungs, and then your body will try to regenerate the cells. But remember, cells do not all of them completely and fully 100% regenerate. Some of them is replaced by cells known as fibrotic tissue, scar tissue. If I can give you an example, when you get a nasty cut in your leg, then you come and I stitch you up. Yes, the leg will heal, but there will be that scar that is left behind. That scar will never disappear. It might look better with age, but it will not disappear. So, um, so it's not possible.
Okay, thank you very much, Daktari. We have another one here. Someone is asking, if you have a person with diabetic condition, how can that person know that he or she lungs are okay, especially if that person has been using insulin for many years?
How can one know that the lungs are okay?
Yes.
All
So
right,
I think
fine.
this one is in diabetic mellitus in relation to respiratory conditions.
Of course, if you have diabetes, you are prone to getting infections, and one of them is, of course, pneumonia. Like I said, is an infection of the lungs. So I think that's one thing that this individual could be, worried about. So, first of all, how to know your lungs are healthy is, first of all, are you breathing okay? Are you having any difficulty in breathing? One, and number two, is your breathing rate normal? And then another way you can, if you want to assess further your lung capacity, is to do what is known as a pulse oximetry. If you go to the hospital, there is this peg-like device that we pinch it onto your finger, and then it says like 96 or 97%, and the doctor says that's okay. It's usually meant to measure your oxygen saturation. Like I've said, one of the functions of the lungs is to take air, oxygen, and put it into your blood system. So checking how much oxygen concentration is in your blood can help us know how well your lungs are functioning. Now, if you want to do further testing, you can do a chest X-ray, or a chest CT if you suspect that there's illness. But I would not go that far, to do a chest X-ray if it's not indicated. And also, when you come to the hospital, the doctor has a stethoscope. We use it to, the thing we have around our necks. We use it to listen to your breathing sounds, and if there is any problem, we might be able to detect it. So there's many steps which you can use to assess how well your lungs are doing. So we usually have what is known as a wellness checkup at Karen Hospital. It's a package. We will assess everything, from your heart to your kidney to your liver. We'll also check for tumor markers that can indicate whether or not you may or may not have lung cancer. And also, one of the packages also contains a chest X-ray. And on top of that, we will also do a physical examination where a doctor will, assess how you're breathing, all that, and so on and so forth. So I hope in that long rant I have been able to answer the question.
Yes, yes. It's clear now, Dr. Thank you for that. We have another one. Someone is asking, what can be some of the earlier symptoms of lung cancer?
Right, coughing. One of the first symptoms is coughing, and especially you cough up blood. Yeah, and then number two, you'll have recurrent lung infections. You know, you have pneumonia again, then you have another lung infection over and over again. So recurrent lung infections, and then you have the coughing out of blood. Later on, you could develop chest pains, when the tumor starts to grow bigger and bigger.
Okay, we have, yes, we have one here on research based. Is it true that lungs grow once they are cut?
Unfortunately, they don't grow back once they're cut. But I will say this: it is possible to live with one lung. One of the treatments of lung cancer is what is known as pneumonectomy, which basically means removing part or a whole, one of the lungs, the left or the right. It's possible to live with one lung, although the degree of the physical activities you can do will be limited. You'll not be able to maybe run a marathon or go hiking to Mount Longonot, but yes, it is possible to live with one lung, but it's not going to grow back. It will not grow back.
Okay, thank you. In fact, that answers our next question. Someone was asking, can one live with one lung? And if so, one lung instead of two provide enough oxygen and remove enough carbon dioxide?
Like I said, yes, it's possible, but there's certain activities will prohibit you from doing, activities that require you to take a lot of oxygen and that can cause your body to produce a lot of carbon dioxide, which is, like I said, running a marathon or hiking.
We have another one here. How is pulmonary embolism treated?
Okay, that's a very good it's a very good question. We use certain medications that are known as clot dissolvers. Basically, we call them thrombolytics. This medication, what they do is that they break the clot, they break down the clot. And then we also put these patients on medication known as blood thinners, otherwise anticoagulants. These are basically medications to prevent further clot formation. But at the end of the day, the damaged tissue, it's going to turn into scar. It will form scar tissue the same way it would transform after a TB infection. Such lung tissue it's not possible to revive it. So the three things you want to do for a patient with pulmonary embolism is to try and break down whatever clot is in there, and then also to put them on medication to prevent another clot from reoccurring. And also you might have to give the patient some oxygen during that time because their lungs have been compromised. What is the next question?
Okay, thank you very much, Dr. I think there's another question here. I think someone was writing, what is a tumor marker?
Good. That's I actually love your this is a very interesting group of a very attentive audience. The questions have been very nice, they're very encouraging. It lets me know that you've been listening and that you're actually starting to care and love your lungs. So that is good. So tumor markers are certain chemicals that are produced by the tumor, the group of cells, the cancer, that group of cells, they will produce certain chemicals. So what we do is that we check your blood levels. We're checking your blood for the levels of these chemicals. A good example is of a tumor marker is a chemical known as CEA. PSA, prostate-specific antigen is also another tumor marker. We have CA19-9, that can show you have pancreatic cancer. We have CA15-3, which is usually used to detect breast cancer. And then you have CA125, which is used to detect, ovarian cancer. But I will say this about tumor markers, okay? Although tumors will produce these chemicals, the presence of these chemicals alone is not enough for you to diagnose a patient with cancer, because there's also other conditions, other infections that can cause these tumor markers to be elevated in your blood system. I'll give you an example. Like I've said, CA19-9 is a tumor marker for pancreatic cancer. But if a patient has pancreatitis, you would expect to see the CA19-9 slightly elevated. An elevated PSA could indicate prostate cancer. It could indicate an infection of the prostate, you know. So yeah, that is what tumor markers are essentially. So for example, if you do come for the wellness checkup and we check the tumor markers and we find like a certain tumor marker, maybe let's say for a tumor marker for colorectal cancer is elevated, I'm not going to immediately diagnose you with colorectal cancer. No, I will just order more tests to, you know, maybe an image, an abdominal CT, you know, colonoscopy to see if we can find a tumor in the said region. And even when a tumor is found, you're still not diagnosed with cancer until what is known as a biopsy is conducted, where a group of these cells is taken to the laboratory, they're viewed under a microscope, and a pathologist will determine whether or not the cells appear to be cancerous or not.
Okay, thank you, Daktari. We have another one. Someone is asking, what are the effects of having PTB and the effects to the lungs? And if one had it like 10 years ago, what is the care required to the healed wounds?
Yes.
The effects of pulmonary TB.
Yes.
You mean what are the symptoms of pulmonary TB, or what are the long term?
Yes, the question is the effects of PTB to the lungs.
Right. Okay. So TB, TB is an infection of the lung.
Even Jen, I tried to enter a meeting, I couldn't hear at all, and that was now on Zoom.
On the phone.
And I couldn't. I tried everything, I couldn't. So I just gave up and blocked it.
Yes.
Sorry for that. Thank you, Daktari. Please proceed.
I think the good doctor is muted.
Okay, thank you. Daktari, you are muted.
Oh, sorry. Someone muted me by mistake. So I was saying that TB is an infection that attacks the lungs. There's a bacteria responsible for TB known as Mycobacterium tuberculosis, hence the name, TB. And what happens is that when you're infected with a bacteria, your body will try to fight off the bacteria using what is known as, your white blood cells. Now, what will happen is that there will be lung damage that will happen, one, by the actions of this bacteria, and number two, by your white blood cells as they're trying to fight off the TB. So, and then usually when your immune system is active, certain fluids are produced by the body. So if I was to describe what's happening to your lung if you have TB, you have destruction of your cells, the cells in your lungs, the alveoli, the ones that are responsible for it. Then you have accumulation of fluid in the lungs, just like with the most pneumonias as we've seen before in the slides that I've shown you. So you have destructions of your lung cells, you have building up of fluid, which impairs your breathing. And then you have the patient coughing. So coughing is actually an adaptation of your body to try and expel any foreign objects that are within your respiratory system, that come out as mucus. Yeah. So you have coughing, and then you have your difficulty. I hope you can understand what I'm trying to say. And then what's usually left behind are things that are known as tubercles, so which are basically collections of this bacteria. So this can happen if there is no if you don't finish your medication, your TB medication, or if you don't enhance on the medication. And what can happen is that later on, you can have a recurrence of this TB. And that's why it's very important to, first of all, make sure that you've completed your TB medication for 6 months. And then after completion, you'd have to repeat another TB test, to make sure that the TB is gone. But just to go back to the question before about the scars are not going to go away. They're not going to disappear. So I hope I've answered the question.
Okay, yes, you have. Thank you very much, Dr. I think the issue of PTB is coming in our questions a lot. Maybe we can consider to have a presentation maybe in future on PTB, perhaps. So any other questions, you can raise your hand. You can write on our chat box.
Yeah. What else is speaking to?
So Daktari, maybe you can comment on the outbreak we have of the flu, and maybe you can guide us on maybe what we need to do. We put on our mask.
All right. So okay. So I mean, yes. Unfortunately, we are in the flu season. What I'd advise you to do is, like I said, first of all, wash your hands. You can use hand sanitizers, and stop putting your hands. Don't touch your face if you can help it, especially your mouth area. If you can get a flu shot, if it's available to you, we do have it available at the current hospital. You can get it. Disinfecting areas, disinfecting surfaces can help. Make sure you're also washing your laundry. Doing laundry is good, and get good sleep. Good sleep is good for your immune system. Make sure you're properly hydrating. You can boost your immune system. Vitamin C supplements. If you don't have vitamin supplements, you can take oranges. Also make sure that your work area, maybe your office or your home, is well ventilated. Make sure the windows are kept open. Yes. And if you get sick, stay away from sick people. Wearing the mask, of course, it does help. It does help preventing you contracting the flu. Yeah, those are some of the things that you can do. And if you get ill, you can pass by your clinic and get your antihistamines and your decongestants.
Okay, thank you for that. So there's in fact someone who is asking about the harmful effects, the long-term harmful effects of using the antihistamine drugs.
Pardon?
Someone is asking that the effect you get from long-term use of antihistamines drugs.
All right. Okay. So what can happen, if you use antihistamines for a long time? So one of the effects of using any drug repeatedly, chronically, is that your body becomes tolerant towards it, and we see this in patients who have in patients who have asthma, because they have to keep on using antihistamines here and there and every time. So you become desensitized towards using those antihistamines if you use them for a long time. And also, although it's very rare, long-term use of antihistamines can predispose you to getting what is known as a glioma, which is a tumor in the brain. It's not cancerous, but it can cause a lot of problems if you have a tumor inside your head. But again, this is a very in very rare cases. Yeah.
Okay. So we have another one, like the one we tackled on PTB, about the long-term effects of the PTB after the 6 months medication.
After the 6 months. Right. I can start by saying, first of all, it predisposes our ladies to getting yeast infections. Another effect of it is it can cause, weight the weight loss. Sorry.
Okay. Yes, we can continue.
Can you? Hello.
Yes, we can hear you, Dr.
Right. Okay. So the question was, what are some of the long-term effects of using the PTB medication? You can have what is known as neuropathy, which is basically nerve damage. It can damage your nerve. The long-term use of one of those drugs. Patients can complain of nausea or vomiting. It can cause changes in the color of your eye if there's a problem with your liver. Long-term use of these antibiotics can affect your liver. It can also cause you to have some skin rashes. But that's why when you are on this PTB medication, you should keep on going for continuous checkup and evaluation where the doctor can see if there's any side effects. Also check your liver function test as well. And also give you a drug that we give for people who get nerve damage as a result of using the TB medication. But what I would advise your audience is not to get discouraged from using from getting this TB medication, because the risk, the benefits outweigh the risk of using the TB medication. Yes, another question.
Someone is asking what is COPD. I think we had discussed this, but maybe you can go back to the slides.
Right, fantastic. So it stands for chronic obstructive pulmonary disease. It's a disease, like I've said, it causes the disease that causes airflow blockage and breathing related problems. You can see this mostly in smokers. What happens is that there is repeated damage on your bronchioles, which are the pipes that take air all the way down to your air sacs, right? So you have accumulation of mucus, you have narrowing of them, and this is something that happens over a long period of time. So patients like this are not able to adequately inhale, and they have, they try to inhale, but the air does not really go, it does not really reach the alveoli. Such patients will have to be put on oxygen, at some point. You can use what are known as bronchodilators to try and like open up those airways. So that is basically what chronic obstructive pulmonary disease is. The disease that causes the narrowing of your airways. The causes are usually irritants, like smoke, over prolonged period of time, of course.
Okay, thank you. We have last one here. Someone is asking that when I breathe, then you hear a wheezing sound. Is it alarming?
Of course, I would say not really such as the case. People with allergies or asthma can have wheezing. I think it would depend what is the degree of wheezing and how long has it been there, But if they're worried, they can always get a chest X-ray for further evaluation. But I would say it's not a reason to start panicking. All right, it's not panicking. Go see the doctor, and maybe you will listen to the chest. And by the way, I would like to first of all mention this, that I've mentioned some few diseases that affect the lungs, and they can produce symptoms like difficulty in breathing. Right? Not only physical illnesses of the lungs that can cause you to have difficulty in breathing. Other psychological issues like anxiety disorders can produce similar symptoms. So I'd say do not panic. Come see a doctor, and then we'll move forward from there. We'll move forward from there, but do not necessarily have to start panicking.
Okay, thank you very much, Tari. Yeah, I think we have come to the end of our questions. So we thank you, Dr. Tarus, for the presentation. It has been
That
very
is-
informative.
Yes.
So we look forward to having this in the future.
All right. So just for my closing remarks, so as you heard, my name is Dr. Hilary Tarus. I work for Karen Hospital. Like I said, one of the ways you can love your lungs is to do general checkups. We do offer a lot of packages for your wellness needs, depending on your financial, your pocket one, and also how much comprehensive of a checkup do you want to do. If you need my services, you can find me on Cardinal Otunga Plaza on the first floor, the Karen Hospital Town Clinic. We're open from Monday to Friday between 8 a.m. to 6 p.m. On Saturday, we're open from 8 a.m. to 1 p.m. and that is the clinic number down there. So karibuni nyote, tunatibu kila kitu, kinga ya boma, mapenzi, wivu, mali kupotea. So thank you very much, Liaison. I do appreciate the opportunity.
Thank you very much, Dr. That's a good one. That's a good one. So I think to our mutual clients, as we wind up, so this presentation we are going to share. You can click, you can even watch it later, you can listen it later. So in case you have any queries, you can contact us. You can see from the last slide, that's our contact. So we have a 24-hour contact center. We have our email. So share what you have or share your request and we'll be able to respond. That is our care team. They are medical people. They will be able to respond to your queries. So we accept any feedback from you and we'll be willing to hear from you. And please note that wellness is very dear to us, as Dr. has said. We encourage you to go for those medical checkups because Liaison has provided medical covers that offer wellness checkups. So please utilize it. We'll be willing to assist you. We can even give you various packages of the open panel of the hospitals that we work with. So expect a lot of engagement from us in these webinars, also from our SMSs and quarterly calls that we usually do from our 24 contact center. So, and in case you have any proposal or topics you may wish that we can discuss or we can engage our doctors, we can discuss that in these platforms. So I think I wish we end there because we had said we end at 11:30 and we are on time. So thank you very much. Thank you for being in this platform. See you. You can now log out.
Karibu sana.